Hello, welcome back. It's Fedi, and if you don't know who I am on a mission to help as many dentists work with as many patients as possible because I'm wanting to help those patients, if that makes sense. The reason is my best friend Collier had his life completely turned around by some orthodontic treatments he had and some cosmetic treatments he had. Honestly, it wasn't just the confidence. The confidence just kind of had a domino effect on the rest of his life. So if I'm able to help someone like Collier indirectly, because I'm not a dentist, I would love to work with more dentists. And that's the reason I make these videos, is to make sure that dentists are able to work with more patients and help more people. And today's video is really, really important, not for the reason that it's a video made by me, is because it kind of outlines the issues I'm finding currently in the industry, by talking to dentists, not just from an outsider's perspective, but mostly really from talking to dentists, and not just in the UK where I'm based, but in US and more specifically Canada. I know that's not in the US, but a lot of the times it's with Canadian dentists as well. And the issue they're facing, it's not really an issue that is talked about often. It's talked quite a lot about in the industry, but at the same time, it's kind of romanticized. And that issue is more so of a personal issue for a lot of dentists, so it can't really be tackled properly in a professional sense, mostly because it's their choice, right? And what I'm talking about is time off. And I know you're probably rolling your eyes. This guy's not even a dentist, he doesn't know what he's talking about. Time off, yeah, I know, I need time off, I'm doing this, I'm doing that. Time management, whatever, blah, blah, blah. But I don't mean time off in the sense that you don't work. That's not what I mean. I'm all for working until that work just becomes normal, not the stress. All right, the stress shouldn't become normal. That's something completely different. That's chronic stress. I'm talking about the work becomes normal in the sense that the extra patients or the extra consultations you have, they don't really affect you anymore. They become part of your day. It becomes normal for you to help people. But what I mean by time off is time off for the business. Time off for you to focus on really important things for the business. So what I'm talking about isn't time off from work. I'm talking time off from being in the chair with a patient. Again, this is also quite controversial because it's what you love doing. It's what arguably you're best at. It's what you've trained years and years and years, potentially even decades for. But the reason it's so important is that so I can't remember who said this, but it's in the NBA, right? When you play good basketball and when you play well as a team, the score, that settles itself, right? You don't have to focus on the score to be able to make the score go up. You focus not just on the hoop, but on getting the ball to the other side, etc., etc. As you can tell, I'm not a huge, basketball player. I don't follow much basketball, and I can't remember the quote exactly, which annoys me. But the point is, focusing on the best patient experience sometimes means not being with patients. That might sound paradoxical, but I'll quickly explain it. So throughout this, the whole 3 minutes now, I've focused on the fact that not many people talk about this, and it's important, okay? And I'm wanting to make sure that you understand I'm breaking it down in little chunks, because if I attack it straight on, you won't want to listen, right? Just being completely transparent, you won't want to listen about why it's important. The fact that patients deserve and need the best care inside and outside of the practice now is evolving rapidly. We've got loads of cosmetic treatments that people can finish, so home teeth whitening kits. They can do at home. There's loads of, consultations they can do online while they're at home. There's so much that they can do and have done to them outside of the practice, outside of the office. So what I'm saying is, you being able to focus on the business and how it runs, not just when the patient is in the chair, but when they're waiting, when they're booking the appointment, all of these little things stack up for the patient experience. And the reason, again, I emphasize this isn't because I'm saying nobody does this, right? Because I'd be lying. But nobody focuses on this. I don't think I've ever seen a 90 or 80% efficient appointment booking process. The dental industry is quite behind in appointment booking. I mean, compared to some other industries, I'd say it's at 40, 50, 60% maximum. And that doesn't, mean that it needs to change drastically now when it's going to change in the next 5 years, but it needs to change because people are getting used to something being quick, efficient, and they're used to having 24/7 support. Now, the solution, I'm going to give you one solution because I can't talk for another 40, 50 minutes about all the different solutions, but I want to focus on one. And this is one that I'm just going to talk about now, not waffle on anything else. And the one point that I wanted to make is the appointment booking process. Okay, the process itself needs to be a journey for the person booking the consultation. Okay, so I'm going to focus on two things: booking the consultation and then returning, so going to the appointment after they have a consultation. It needs to do two things. It needs to entice. Okay, so it needs to entice the person to book the consultation, and it also needs to make them feel comfortable. Because something we don't talk much about in business, really, is making people feel comfortable. Because at the end of the day, they're people. Of course, they want something fast, but that's part of making something comfortable. There's less anxiety, there's less stress, when you don't have to wait for something. So making comfortable, more specifically, I'm thinking about the process of you, right, giving them a good offer before they have, so they're going to book the consultation. Building them a good offer puts patients at ease. It puts people going into consultations at ease. They might already know the price. They might already know what they're getting. Your offer shouldn't be a free consultation. Your offer should be focused on something bigger. And I'm going to give you the best example I can think of right now, which is reversing all the risk. This is especially for cases where these people need this treatment. And I love to use the example of implants because when someone is missing teeth, there aren't many solutions other than implants, right? So when someone needs an implant and you create them an offer to have a consultation on implants, you give them that offer by saying, you get a free consultation, right? It doesn't even have to be a free consultation, right? You get a consultation. With that, we're going to help you create a plan, and we're also going to give you all the information necessary within the consultation and outside the consultation, and then we can also help you finance it. So the reason I give this example is because it focuses on two areas. One, the most important one for a lot of people, is finance, right? Implants are quite expensive. Secondly, it also gives people the knowledge that they need, because a lot of the time patients don't want to go forward with the treatment because they just simply don't know what it does. I don't know, that sounds quite blunt, and you might take time to explain it to them, but sometimes they just don't understand it. So the solution to both these things is really, really simple, actually. The first one, finance, is just to have a finance scheme, whether it's officially a finance scheme that you have right within the practice that everyone knows, or within the office that everyone knows, that everyone does, right? Split it in 3 or 4 payments, no interest, blah, 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 split it in 10 payments, etc., etc. That's up to you. But the second one that I find really interesting, that a few are doing now, and that I really like, especially when I'm seeing it on LinkedIn, is having mini courses, mini education courses online for your patients to watch outside of the practice. What that means is any concerns they have with any pains, any concerns they have about side effects, any concerns they have about what they're going to look like, any concerns they have about, how long it is until their next checkup, that's all done online. They don't have to call you. That's going to take up more of your time. They don't have to wait to hear a response by email. They have this little portal. They literally just log in. You can even put it on YouTube. There's no need for a portal, where they have 5, 6, 10 videos explaining some little things about implants that they should know that you weren't able to explain in the consultation. And these can all be pre-made. You can give them again and again to different patients. And what that does is that puts them at ease for every little issue they have and every big issue they will have with implants. So I know it was quite annoying at the start when I was rambling on about something being really important and something that improves the relationship you have, the comfort of your patients, easier to get consultations. When you have this as part of an offer, it puts so many people at ease. Because you haven't just made a fantastic experience for your patients in the chair when you have given them amazing implants, when they can smile again, when they can chew without pain. What you've also done is giving them the knowledge, giving them the self-confidence in the information that they know that what they're doing is the right thing. The second thing I wanted to focus on, and now I actually might do in a second video because I really want you to just understand the point in this video. Right, yeah, I'm doing it in a second video. So I'm going to do about getting them from this consultation to a booked appointment in a second video. Don't know what I'll call it, just subscribe and you'll see it. But it'll be the next one, so you don't have to subscribe and keep watching other stuff you don't want to see. But the point in this video, and I'll recap it really quickly, without going on the whole tangent and story, but people are on a journey in every little thing they do. They're on a journey when they buy something off of Amazon. They're on a journey when they go to work. Not literally a physical one as well, but they're on a journey when they go to work. They're on a journey when they make a phone call to their parents. These journeys, these little steps that people take to accomplish whatever they're doing in their day, it should be made easier by you as their dentist. Because if something is streamlined, if something is easy, we return to it because it causes us no headaches. Let's just say I just had implants done. I hope not at my age, but let's just say I had implants done. And then I figured, you know what? My implants look lovely. I want teeth whitening. Guess who I'm going to go to? You might not even be a teeth whitening expert, but guess who I'm going to go to at least for the consultation? You've given me so much information in the last consultation with implants, and you've given me even video courses to understand more about implants. Obviously not how to do them, by the way, just a disclaimer, don't teach your patients how to do implants. But you've given me so much information, you've given me so much comfort, you've given me so much value. What choice do I have but to return to you? I literally don't have a choice. The offer of explaining and helping people understand a certain topic about their health and their relationships is going to be so big in the offer. Plus adding the finances to that, who's going to say no? Tell me how irresistible that is. You might hate seeing ads online or anywhere. But imagine if you saw an ad from a dentist saying, you get a free implant consultation. Not just that though, I know it's quite difficult to finance implants, so we've got a finance plan where you can pay it over 10 separate payments. And because we'll have 6 different appointments, you can pay the first 6 installments and then the other 4 in the remaining of the year. The remainder of the year, sorry. And then guess what? We understand how confusing implants are in a lot of cases. We don't have time to cover everything in the consultation. So when you sign in with a consultation, afterwards we're going to send you a free video course. I wouldn't say no to that. I might not even need an implant and I want to go to that consultation. And it's not even irresistible in the sense that you can't say no to it because it's so enticing that you need it. It's just exactly what you want when you're going for an implant. And although this might be different on a lot of other treatments, right? For example, Invisalign, of course you can do some courses on Invisalign. They're going to be a lot shorter. Invisalign, everybody knows about it now. It's all over TikTok. It's all over social media, and not just TikTok, to be honest. It's all over social media. But when you give value to your patients, it doesn't just have to be in the chair. And in fact, not only will it make you more money to do stuff outside of the chair, but it'll also make you a better dentist. Because dentists, although at dental school the only thing you're taught is to do with teeth, mental health, oral cancer, etc., a lot of the time what you're doing is building a business when you're building a dental office. You're not just building a dental office, you're building a dental office. Ignore that last part. That was terrible. Dental office, dental office. You can ignore that. But anyways, I've got a little plug, right? I've got a little video in the description. It's a link that you can press, and it'll be a video of me trying to sell you something, just being fully transparent. No point in me lying or trying to get you to click it just for you to click away. But it's a video of me trying to sell you something, and what I'm wanting to sell you is booked appointments, basically. I want to help you get more booked appointments, only if you need them. If you don't need them and you don't care about booked appointments, that's absolutely fine. You don't have to click the link, but if you do, you can book a call with me. We can talk about your business. We can talk about your dental office. We can talk about more about getting booked appointments, and if so, go ahead. And if you like the video, pop me a thumbs up. It just shows me that you liked it and that I did a good job. If not, you can leave a thumbs down. It also helps me out, to be honest, to know whether I did a good or bad job. Leave a comment for anything you wanted me to add in this video, or anything you want me to do outside of this video to explain another video, and subscribe for part 2, which is about getting people from the consultations to the booked appointments when you're not in the consultation, if that makes sense. And that's it. I really hope you guys have a lovely day. I genuinely hope I've been of value to you in some way in this video. I mean, that's literally why I make these videos. It would kill me if these were terrible, and they kind of are. But have a lovely day, have a lovely evening, week, weekend, night. Honestly, whatever time is where you are, wherever you are in the world, God bless you, and I'll see you soon.